Good morning, my name is Heidi Childs. This is my ID. And this is my practice assessment for Dixie's Nursing 3200 class. My volunteer is Sawyer and his mom Anna, and my practice diagnosis is bacterial meningitis in an infant. So just to go over the equipment I have today. I have hand sanitizer, gloves, a pen light, I have a thermometer, a pulse ox, and a stethoscope, and then just a measuring tape. So that's just to do my baseline assessment on the baby. And then the only thing I'm missing is a ophthalmoscope and a blood pressure cuff because I don't have an infant-sized one here at home. So we will get started. I'm gonna wash my hands and put gloves on. And then the three systems I'm going to be focusing on today for this diagnosis of bacterial meningitis are neuro, respiratory, and musculoskeletal. What is that? And my patient for this assessment is Sawyer. He's a 4-month-old male. And I chose to do an infant for bacterial meningitis because some of the signs and symptoms are different, and so I just thought it would be interesting to note the differences. So first I'm just going to get a baseline assessment. I would just be looking for any signs of distress or lethargy. Obviously none here. To get started with my neuro assessment, this baby is obviously very appropriate, makes eye contact, is smiling, brings his hands to his mouth. I'm going to palpate his fontanelles. For a bacterial meningitis diagnosis, I might expect full or bulging fontanelles. Also, I'm going to get an occipital frontal circumference on him. And because with a diagnosis of meningitis, I might expect it to increase over time as intracranial pressure increases. So his OFC is 44, so we would make a note of that to compare it to later assessments. I'm going to assess his pupils. I want them to be equal, round, and reactive, and they are. And then also just his point-to-point location. So if he sees a light over here, I want him to follow that. If he sees it over here, I want him to follow that, which he does. Depending on the age of the infant, they might grab. Hi, what's this? What is that? Just see what his localization skills are. What is that? He's more interested in his hands right now, but I wouldn't chart that as an abnormality for him. Let's see, neuro-wise, I'm just going to note his level of consciousness. So with a diagnosis of bacterial meningitis, usually they're brought in near comatose to the hospital. It's a really sudden onset lethargy. So they go from being fine and eating and acting normally to just being so lethargic. Not the case here. So the next system I'm going to assess is respiratory. First, I'm just going to observe. I'm going to look at his work of breathing, whether I see any intercostal or subcostal retractions. I don't see any on him. He looks warm and pink and well perfused. His cap refill is 3 seconds, which is within the normal limits. I'm also going to listen to his lung sounds. Respiratory distress is one of the first signs of abnormality that leads to a diagnosis of bacterial meningitis. The younger the infant, the less specific the symptoms are. They usually just present with a more general picture of sepsis and then are later diagnosed with meningitis. So I'm just going to listen. I'm going to note his heart sounds, and then specific to respiratory, his lung sounds. I'm looking for clear equal bilateral lung sounds in all of his lobes, noting for any diminished areas or areas of coarseness. He sounds very clear and healthy. I would also ask mom about any signs of apnea. that can be a really telltale sign in infants. They'll have these brief apneic spells where mom notices that they stop breathing, and then that's what prompts them to bring them into the hospital. For a really young infant, like less than a month, that can be normal, but for this age of 4 months, that would be symptomatic. So next I'm going to assess musculoskeletal. I'm going to see what he's looking at, see if there's any like neck rigidity. Neck rigidity is a really telltale sign in adults of meningitis, but it only occurs with about 15% of infant diagnoses, so it shouldn't be overlooked, but is also not a reason to say, oh, it's not meningitis because they don't have neck rigidity, because often they don't. And I'll just look at his back and his spine and his movement. He's obviously a very strong baby, very appropriate movement, weight bearing on the legs, not lethargic at all. You want that? One more thing to note, just position wise, if there is at all a suspected meningitis diagnosis, the diagnostic test is a lumbar puncture and culture of the cerebral spinal fluid. That's done by a provider, but the nurse would hold for that procedure, and really important just to know the correct way to hold. So we would lay baby on their side like this, and they will be mad, they don't like to be on their side like this, and then kind of fold them in a C shape like this, and they'll do the lumbar puncture down here. It'll be a sterile procedure, they'll drape it sterilely. So yeah, you just get really good at holding strong kids down, but not needed here. Hi. So suspected or anticipated treatments for a baby with bacterial meningitis or even empiric suspicion of that would be IV treatment with ampicillin and gentamicin, and then obviously the cultures of the CSF, and just continued monitoring of the neurologic function, level of consciousness, and improving lethargy, feeding, and respiratory effort. So that is my practice assessment. Thank you to Sawyer. He does not have bacterial meningitis, and I guess that's all. Thanks.